My name is Dr. Kulvansi Sodia. I'm a resident of Mathura and I did my MBBS from All India Institute of Medical Sciences, Patna. Currently, I'm in the third year of residency of DNB Family Medicine program of Sir Ganga Ram Hospital. So, why did I choose DNB Family Medicine? I think this question has been asked to me more times than I can remember now. Initially, I wanted to become an orthopedic surgeon, but over time I realized that I cannot keep standing for hours and dissect stuff out of people, like not my cup of tea. And I realized over time that my natural tendencies is more towards diagnosing the cases and treating them, mostly towards diagnosis. This gives me a certain type of thrill. I don't know how, but well, I just likes the thrill of diagnosing stuff. So medicine was a natural choice for that. And there's also the thing that I've seen, to diagnose stuff you need a huge amount of knowledge. In medicine, it's a huge ocean of knowledge, but family medicine tops over that also, that you are learning about pediatrics also, obs gynae also, surgery also, and other subjects also. So your knowledge base becomes even much broader than the general medicine. Yeah, it's not that deep in certain things, but yeah, it's very broad. And to become a better diagnostician, I think the broadness of the knowledge is very much important, so you can see the patient collectively as a whole. So that was another reason. Also, there is a personal story of mine which happened with my mother. I was in the fourth year of my MBBS when she started having repeated dizziness and heating sensation in the throat. It became so much, the dizziness mainly, that she was not able to do her regular activities also. So initially we took her to ENT specialist, then general medicine, then even neurologist, but the symptoms are not completely relieving. Beta histine was also like going on the higher dosage, and still she was suffering from all that. Every time she was stopping the drugs, she was having the same symptoms. I remember I was reading about the postmenopausal syndrome in the fourth year, and I realized that all the symptoms described in the this disease is my mother is having all of them. I ran to my gynae consultant in the college and I told her about my mom, like what symptoms she is having, everything, and she agreed that yeah, it's postmenopausal syndrome. She is having hot flashes. We started her on OCPs, then later shifted her to gabapentin, and within a week she was completely normal, and she's off medications now. It went for like 2-3 years, but like yeah, she's completely normal. I feel if a family medicine physician would have seen her on the first time, he was much better equipped to make that diagnosis than other specialties, and she would not have suffered for so long if someone had made her diagnosis early on in the disease. And a family physician, I feel, is much better equipped for those kind of diagnoses, and other also, but yeah, like he could have made the diagnosis much faster than other physicians and have saved a lot of money, like on the investigation and everything. So overall I feel family physicians are much better equipped on making diagnoses and much better and like economical than the other specialties. So this is why I'm more lean towards family medicine. Also, the other thing is, it's ironical that I'm saying this, that I don't like to study. I can study, it's not like I don't want to study. I can study when I have to diagnose someone, so I can read all the symptoms, like where it's fitting. I can read hours for the treatment, but academically I cannot study at all. I hate studying for the academic purposes, like passing an exam and all this thing. I just hate it. But for like diagnosing and treating patient, I can study on for hours. So family medicine being an end branch, I don't need to go into the super specialization. This is one of the reason I took family medicine. Like I'm done and dusted with the family medicine. I won't study at all after this. So yeah, these were some of the reasons I took family medicine.